Hello, and welcome to Altru's video forum. As everyone knows, the implementation of Epic systems here at Altru is a major endeavor. It has required the work of many and will soon become part of almost every employee's work processes. We have high expectations for how Epic will help meet our goal of becoming the provider and employer of choice. Today, Mark Wayne, Administrative Director of Information Services, and Sharon Fletcher, Manager of Learning and Organizational Development, are here to provide an update on Epic as the first phase of implementation is underway. We will discuss what is included in our first phase of implementation, how our patients will be impacted, and what training is available. Hi, Mark and Sharon. Thank you for joining us. Epic is a hot topic around here. What exactly is included in the first implementation, and when will it go live?
Registration, scheduling, and billing will be the first modules that we're going to introduce on February 9th. And this is going to impact our Grand Forks, our Crookston, our Drayton, our Red Lake Falls, our Fertile, and our Erskine outpatient clinic settings.
How will our patients be impacted by these changes?
On February 9th, we're not going to see a lot of change for our customers. We'll start with our automated schedule reminders for patients, and we'll have some pre-management things taking place in which we're calling the patients ahead of their appointments to make sure we've verified all their information. But really, we're setting the groundwork for our April 1st go live, which is going to introduce more of the enterprise scheduling concept and all of the benefits from that, along with the single patient bill that's been a long time goal of ours. We'll be kind of moving towards that. We will continue to have some legacy systems that we'll have to bill out. Once we've completed that, then the patients will see all of their billing information showing up on that single bill. And one of the more exciting things that will be coming in the April 1st go live will be the My Health. And the My Health is going to be introduced to, first off, our employees as of April 10th, and then on April 30th, we're going to introduce it to some of our customers. Some of the functionality that these patients will have with My Health will be results review, appointment requests, appointment review and cancellations capability. Medication history will be able to be looked up. Immunizations, prescription renewals, statement reviews, and bill paying will be able to be done.
Since the Epic system is going to impact the work processes of nearly every Altru employee, how and when will employees be trained?
Scheduling of our employees is extremely important. We've been able to provide training tracks for each one of our employees, as well as our physicians, to provide them with the courses that they need to take, the objectives of those courses, and the number of hours in which those courses will be. Fortunately enough, we've been able to log much of our training tracks through NetLearning. For our physicians, however, we've been able to send out a note to their nurses and our administrative directors to advise them of the specific courses that they need to take, and then we have a process in which they sign up for those courses.
After initial training is complete, will there be ongoing support?
Training will continue to be an important and vital element for Epic, even beyond the implementation of the applications. Our principal trainers have done just a fabulous job of putting together all of our lesson plans and curriculum, and they will continue to serve as a vital resource for us through learning and organizational development in the future. We will have makeup courses for those employees that were not able to attend their scheduled training time. In addition to that, we know that we'll have functionality changes in the future, as well as upgrades to the system, which will be vital for us to be able to provide that opportunity to be able to train or retrain employees as needed. So we will have a long-term vision that will be elaborated on in the future for training.
The implementation of Epic is a big change for our organization. What type of feedback have you heard from those using the system?
You know, initially from our principal trainers, the first couple of days of training were such an exciting time for them, and the feedback that we received from our learners in the classroom has been very positive. The ability to see efficiencies in the system, to be able to see the long-term vision, is really why we've moved towards implementing Epic to begin with. And I think the realization of that now for all of our employees as we continue through training will become even more important to them and important to the organization to visualize.
There's been a lot of excitement from really everybody that's had an opportunity to see the Epic system, starting from the folks that went through the demonstrations over a year and a half ago. We look at our project team with all the training that they went through, and our physicians that have had some exposure to the Epic product, all of them have seen all of the features and benefits and the capabilities of Epic and are really excited because these are features that we haven't had with our existing products. We're fortunate to have a number of physicians that have worked elsewhere that have used the Epic product, and they really bring a lot of insight as to how that system is going to benefit our Altru health system.
Thank you, Mark and Sharon. In fact, here's some feedback from a few Altru physicians who had a sneak peek at the system.
Well, I'm really excited about Epic. I think it's going to make my practice much more efficient, especially with the templates and the smart text and all.
I think also it helps us share information about patients so they get better care. I think the documentation is wonderful, that you have everything about the patient in one place, so you don't have piecemeal to go looking for things. So I think the access to lab, the access to other people's notes, all that stuff will help us give better patient care. So I think it's a good tool that as we learn to use it, it will serve the patients and us both very well.
Thanks to all of you watching. For comments or questions that you would like addressed in an upcoming forum, please contact news@altru.org.